am a technician here at NorthStar. I primarily work in the oncology service. I also work in some of the other departments helping out, and I'm recently specialized in veterinary oncology as a technician.
When pets need subcutaneous fluid injections, Heather often helps teach owners the process.
We send you home with everything where you pick it up from us. And typically you have a fluid bag. They come in a variety of sizes. This is considered a liter that is actually divided into 100 ml hash marks for you to actually measure out your fluids. We also send you home with an administration set. This actually I'll show you how to put into the bag. And of course you're then sent home with also needles. Different sizes for different patients. We're going to be using an 18 gauge today. 20 gauge is also something that is commonly used for fluid administration. Typically when you're at home, this can be done as a 1 or 2 person job, depending upon how well your pet allows you to do things to it. It might just take you, or it might take a second person. Your bag actually has to hang up higher and allow gravity to help the fluids go into your pet. So you can use a coat hanger. We actually have something here that we use and hang on a variety of surfaces when we're doing this. A coat hanger works just fine, as well as maybe putting it on a door such as this, or a cabinet in your kitchen or bathroom. Some people, if you have a second person, can just actually hold the bag for you. To actually, what we call is spike your bag, or introduce your fluid administration set into the bag. So what you do is open the plastic wrapping on the outside. You're going to have an administration set that actually has a spike adapter, as well as the tubing. You then have a variety of clamps. You have a slide clamp that can include the line, as well as a roll clamp. We use this more on our end here for slowing down the fluid introduction rate, and we'll go over what you'll do at home once you're giving the actual subcutaneous fluids. As you continue down this line, which is approximately 110 inches, you'll actually have a port that you can actually introduce additives. You're not going to most likely use this at home when you're doing fluids. And of course, at the very end here, this is actually where you'll attach your needle. And this is considered a lure lock mechanism that will tighten and hold the needle in. Turn your bag upside down. Pull the tab off. And sometimes it takes a little bit of elbow grease to do that. Take off the cap of your vial, fluid administration set, excuse me. And you're going to push in, and typically you're going to have to actually crank it in with a twist turn motion as you drive it in. So now that you've introduced the fluid administration line into your bag, essentially you're ready to append the bag, and this is technically air or a vacuum seal on the line almost at this point. So we need to what we call prime this line with your fluid. So this is where your clamps come in handy, is if you're not ready or you're on a surface that you may not want fluid to drop upon, is that you can actually use your slide clamp to occlude your line. And as an extra added safety measure, your roll clamp can be turned all the way down. One versus the other is probably sufficient to do this. It's up to you if you choose to choose both. Turn your bag upside down. And what we're ready to do now, and I'm going to just demonstrate over top of a surface that I can wipe, is undo the slide clamp as well as my roll clamp. And you'll see that fluid starts running down the line all the way to the end. Once it gets to the end of the line, this is primed. There's fluid filling the entire line. And what we can do next is actually attach the needle. What you're going to do is undo whatever wrapping it has. And this is the end that's actually going to attach to the end of your fluid line. This is a lure lock clamp, and so you are going to actually loosen it. And this way is actually rotating it clockwise, pulling off the cap covering it, and then introducing it to the needle, sliding your lure lock mechanism back up, and doing a counterclockwise motion to tighten it. You're now ready to actually introduce your fluids to the animal. It's also important at this point in time is to know how much fluids you plan on giving and also what your start point is. So this is all determined by what your doctor stated to give, and you can easily just mark off on the bag, potentially with a Sharpie, if you need to see the lines better of how much you're to give. So obviously the bag runs from 1 to 2, 2 to 3. There's half marks in between all these. 1 to 2 is 100 milliliters, and if you were to bring it down to that half line, you're only giving 50. So determine how much you need to give and where your start point is. Typically these fluid bags can be used multiple times with putting on a fresh needle before every administration. So you will have probably fluid left over in your bag to use for an additional administration. You're going to be giving fluids to your pet normally in an area where there's an amount of skin that you can actually tent or lift up. And you're going to be inserting the needle into that. This is Allagash and Sheila. Allagash is who we'll be demonstrating on today, and Sheila has been kind enough to kind of give a little bit of a hug to him, which you may need to do at home with a second person. This is a two-person job on this pet. So we're ready to go ahead and remove your needle with the bevel up. I'm going to actually locate an area of skin with my non-dominant hand, lifting the skin up with my middle finger and thumb. Landmarking with my index finger where I'm going to actually guide that needle. And without poking myself at a 90-degree angle, I'm going to insert that needle right under my index finger, pushing through, and you're going to feel a little resistance, and then you'll be home free. Drop that skin. I don't see the needle poking out anywhere. I'm going to release now my clamp, and the fluid's actually going to start coming into the line and going into my pet. You may start seeing a bubble form where your needle is inserted, and at this point it's the job of whoever's administering it to make sure that they're giving the right amount of fluids. So continue to watch your bag fall and stop the clamp when you've given the desired amount of fluids to your pet. You're going to remove the needle by actually just pulling backwards, and with a piece of paper towel, cotton square, you can lie it right over top of where that needle is coming out of to hold it closed to make sure none of your fluids escape. Apply some gentle pressure, recap your needle, and you're done giving fluids. You can actually go ahead and, depending upon if you have to give fluids again at a later date, put on a fresh needle at this point and dispose of your contaminated needle into a tin to hold on to, a Coke bottle. Typically, try not to throw these into your regular trash.
More information is available at www.northstarvets.com.
Handsome me.
Heather and the team at NorthStar are always available to help you and your pets.
The medicine is amazing, the people are amazing. We want what's best for the client and the patient, and so to see so many services coming together to give all around 360 care is out of this world.